Okay. Yeah, perfect. Great. Is the voice clear? Is the camera okay?
Hello and welcome. Thank you so much, everyone, for tuning in. Good morning, good afternoon, good evening to all of you. हिंदी में एक कहावत है देर आए दुरुस्त आए. Maybe I'll translate it in English for you. Not exactly, but when you start off with a mistake, once it's a mistake, second time it's a choice. When COVID hit us, we were not ready for it. Maybe with the second wave, we were underprepared and overestimated ourselves. With the third wave, if we skip on preparing ourselves, we will lose a lot of people who are going to be our future leaders. With us today, we have Dr. Natwar Sharma, who is a pediatric surgeon, who is for a minute also known as a pediatric incentive
Intensivist. I'm a pediatrician and
intensive.
pediatric intensivist.
I had to literally Google what does that mean. Basically, for those who are like me and don't understand these clinical terms, he deals with people and kids especially who are facing issues and are severe. Right now, on this episode and on this session, we will be discussing what the third wave has in store for us. Safe to say, we are in the safe hands of Dr. Natwar, who will walk us through what are the issues that we should be anticipating. How do we prepare better for the wave? And what will it take to save ourselves and our future generations from this virus? Thank you so much, Doctor, for your time. And why don't we start with a quick introduction? Since I went slightly wrong there, I'd like you to, walk us through what.
Thank you, Prerna. So basically, I'm a pediatrician and pediatric intensivist. And currently, I'm on a sabbatical in Kuwait. I work with Al Seef Hospital, and I was working as associate professor in Savita Medical College in Chennai. And yeah, we've been going through a tough time the last 1.5 years and so. And so I would like to discuss issues which kids can face, if we have a third wave which is going to impact children, and we expect that might happen. So it's good to be prepared.
So, Doctor, I'd like to intervene here, right? Why do you think we will have a third wave?
Okay, so I call it a cyclone effect. When you have a cyclone, a heavy wind, and suppose there's a forest. So in the first wind, which trees fall away? The trees which are rigid, okay, which don't move, which are not flexible, they fall off. Imagine a next wave comes in which is more severe than the second one. Who are affected? The old ones, the old trees already gone. The younger trees, okay, which are flexible but not so, and they succumb. In the last wave, wind which is very, very heavy, even the tiny ones, can get uprooted. So, extrapolating it to our setup, old people dying in the first wave, most of them. Then the second wave impacting the younger ones also. So in the third wave, we have kids. So though they are flexible, the immune system are good, but there are complications that may arise. It's not about how many will get affected. Okay, it's about the prevalence. For example, 100 children are affected or 1,000 are affected, okay, by COVID. Maybe one is having a severe COVID infection. But imagine the wave is so big, it affects almost 90% of children. Imagine the number of severe children we'll have to face. That is what it's all about.
And does this impact newborn babies? And is there an age group that we are seeing?
Yes. So it can impact any age, starting from newborn until 18 years, as we've already noticed. And the severity is supposed to be more in infancy, in children less than 1 year. But when you look at the MIS syndrome, which we'll discuss, or Kawasaki, it's highest in children age group between 6 to 12 years. So here, if you look at the risk factors, what are we concerned about? So children who are immunocompromised, who have cancers, who are on immunosuppressants or hematological disorders or blood disorders, or chronic lung conditions, or chronic heart problems, obesity, chronic kidney failure, neurological problems, and as I mentioned, age less than 1 year and premature babies have higher risk of getting severe COVID. And when you look at alarming symptoms, they can be labored breathing, or the breathing can be in pauses or irregular, or breathing can stop. It's called apnea, and grunting. We will have a look at the video to explain these symptoms. And the next one is the bluish discoloration of the body. When the oxygen level goes down, so the body turns blue, and that's called cyanosis or bluish discoloration. And then we can have drowsiness, lethargy, confusion, fits, chest pain. So pale, mottled, cold hands and feet, okay, indicate severe disease or shock. And of course, persistent diarrhea and vomiting are alarming symptoms that we need to be aware of. So these are the key symptoms we need to be aware. Every individual must be aware that if this is there, they need urgent attention.
So this by people, you mean parents will have to look and observe their children. What is the average time span that it takes for parents to detect? Is it easily understandable? Because of course kids can't express and tell us, right, that I am facing this issue. So what are the roadblocks that we are facing currently in detecting this?
Okay. So if you look at the list of these symptoms, which I just mentioned, I would actually make a suggestion that we create videos, okay, which actually explain these visually, along with, auditory feedback as to what actually these things mean. For example, grunting. Most people don't know what grunting means. Okay. So let's look at this video, you'll understand. So watch this infant, look at his chest, there are severe retractions, chest indrawing, you can see that. This basically means the child is having breathing difficulty. Yeah. Or even the sternum going inside, as you can watch in this video. So these are one of the alarming symptoms. Okay. And as I also mentioned, grunting is a sound which you will hear soon, which is again an alarming symptom, wherein the baby makes that sound, a weird sound. That means the lungs are compromised. And now when you watch here, the baby was having jerky breathing, okay, and here the baby is not breathing, which are really alarming symptoms. And this is what I was talking about, bluish discoloration, okay. And if you notice this mottling, yeah. So the sound which I mentioned, and this is about Kawasaki. If you notice the red eyes, okay, which is another alarming symptom, the red lips and the rash on the skin, and the swelling of the lymph node around the neck, the strawberry tongue, the swelling of hands and feet, and the peeling of skin, which is actually a later manifestation, but we need to catch them earlier, because by the time peeling happens, it's already late. the damage is done. So this is just a sample video. We need to create, better videos, because I'm not good at creating videos. So we need to create educational videos which create awareness in every parent, okay, every medical professional, to identify these problems early, so that we are ready when these severe cases come in the third wave.
So, doctor, I have a question for you. You said grunting, right? What is the sound like? Uh,
So
what kind of sound does the kid make?
the sound, this is the sound that comes, typical grunting sound, which is again alarming symptom. That means the lungs are failing.
Okay. And if, I mean, I think that's lungs are failing sort of sounded very scary to me. But is there anything before that? Like for him to reach that stage, there, or for the kid to reach that stage, there has to be some background, right? What are the levels?
So as we saw in the video, initially there is the baby is breathing fast. Okay, that's the first stage. In the second stage, then the chest indrawing happens, baby breathing harder. Okay, and then the grunting develops. So in the first part of video, what we saw actually happens when you have COVID pneumonia, okay, or severe COVID, which can cause shock. Whereas the second part, what we saw, the redness of eyes, the strawberry tongue, the swelling of the neck, the rash, the hands and feet swollen, do happen actually as an immune phase. So what are we mentioning? What are we talking about here is MISC syndrome, which will come in a moment. Okay, so I'll explain about it in a moment. So let's go to the common symptom. These are the common symptoms between adults and children. Okay, most of them are common. If you notice, fever, cough, cold, throat pain, headache, fatigue, muscle pains, loss of smell and taste, appetite, diarrhea, pain abdomen. And when you go to the next
So,
one, hmm,
So, doctor, just to stop you right for a minute, to get to these symptoms, does the child have to come in touch with the a patient who has been detected with COVID? Could be an adult, or is there a possibility that, I mean, is the virus similar? What are the similarities between the two? Before we move to MISC, and maybe we can take that.
yeah, there's no difference. Same virus affects children and adults. Okay, the transmissibility is same, and most of the milder symptoms are similar in adults and children.
Okay, got it. So when you talk about MISC, is MISC something that happens before or after?
Yeah. So the symptoms which I've mentioned happen actually when we have COVID, when the COVID is in the body. Okay. But MISC or Kawasaki happen actually a few weeks after we recover from COVID. So basically, it's an immune reaction. So the COVID is already gone. And then after a few weeks, our body starts producing antibodies and starts attacking our own organs. So
Is this
this doesn't.
something?
Mhm.
Is this something that happens only in children?
Yes. So most of the cases are detected in children. There have been cases where they have gone up to 21 years. They found individuals until 21 having this, but this is usually in pediatric age group around 18.
And you just mentioned something called as Kawasaki. So is there an overlap of this?
Yeah.
And what are the how do you define if you have a MISC or if you have a Kawasaki, and what is happening to the child? Because for parents also it might get confusing, right?
Yeah. So let's clarify one point. So there are defined criteria to diagnose MISC. So there are two guidelines, one given by CDC and other given by WHO, wherein you need to have certain criteria to diagnose MISC. Okay, if you look at this huge list of symptoms of CDC mentions, you need to have age, okay, age less than 21 years, then you need to have fever, and apart from fever you need to have the lab symptoms, and then involvement of heart can be there, kidneys, liver, brain involvement, bleeding can happen. And then if you look in the last part, they should have uh, evidence of having COVID infection. Okay, that is antibodies. Okay, Usually, PCR is negative in these children. But as you know, PCR can be positive in normal individuals until 28 days because even the dead virus particle is detected in the nose and that can be positive. That doesn't mean you are actually having the virus in the body. Most of the children with MISC have antibodies already formed. So it is an immune reaction that happens a few weeks after actually having the COVID. So what we described in the first part of the video was what happens when we have COVID, the COVID pneumonia, okay, wherein you have respiratory breathing difficulty, and also if it becomes severe, you may have shock.
So I would like to intervene here, right, doctor? When we as an adult have COVID, we isolate ourselves for 14 days, which is not going to be possible for kids because they can't take care of themselves. So now, how do you go about that?
Yeah. So you are right, Prerna. This is a very practical problem. Kids always want to be around parents, and you cannot isolate them. Okay. So having said that, if you look at children less than a year, of course, babies can't be left alone. Okay. There are a lot of questions arising. Do we feed the baby, not feed the baby? Yes. So what we need to do is wear the mask, okay, even at home, to reduce the viral load. Okay. But if the kid is already having it, okay, one of the parents need to be with the kid. You cannot just leave the kid alone in one room. Okay. To reduce the viral load, wear the mask at home. But in a child who's less than 2 years, mask is not advisable because it can cause suffocation and complications.
So I have two more questions here. When you talk about mask for a child, also, do we have the facilities? And even when it comes to respiration, right? We need ventilators. Do we have the facilities in our ecosystem that will help support the requirement that will come through?
Yeah. So if we develop severe COVID in the when you have corona pneumonia itself, or we develop MISC in later part, in case it happens, because MISC is not common. It's like we don't have the exact data. How common is it? But it is not very common. Okay. Having said that, see, what do we need to treat? Most of the times we need oxygen. Most pneumonias will resolve when you give oxygen. And to give oxygen, we need to have the appropriate size mask because you have neonates, you have infants, you have children under 12 years, so the mask size differs. So many setups don't have pediatric sizes available. That's a big challenge. Number two, when we need to ventilate these children, we need to have equipment, to put a tube inside, use a proper laryngoscope size, and then the ventilator should also have a pediatric module inside it. You cannot use an adult ventilator to treat a child. So that is going to be a big challenge because most of the ICUs have adult ventilators, and the number of PICUs we have, pediatric ICUs we have, which are catering only to children, are quite a few in number. And that's the biggest concern. Right now we can handle, but if the numbers increase, we'll be flooded and we won't have enough manpower and also ventilators to address.
So, I mean, that is one of the most disturbing situations. And the more I hear about it from you, I don't know, I am very scared. And what I want to understand is how do we stop this, right? Like, how do we save our children? Because it's natural, things are opening up. So gradually, there will be multiple unlocks and we will be venturing out. How do we protect our kids from getting this virus?
See, the precautions are same as adults. Okay, so to wear a mask, wash hands, 20-second hand wash, use hand rub, and maintain social distance. Okay, the reason why schools are not opening is because once the schools open, you're right, the infection will spread. A child cannot be maintaining a proper hygiene, whatever said and done. So these are very important, and that's why online schooling is going on, and right now that's a good option because once you open up, it's going to be difficult to handle.
So I see 2 points here. One is creating awareness amongst our children and telling them what is the pros and cons, and then second is also ensuring that we have the facilities and healthcare facilities. If you can give me a rough ratio for one infant, how many care? What's the facility that we have right now in the country?
Okay. So if you look at the facilities, okay, so yeah, if you look at the facilities, actually there is a dearth of facilities. For example, you go to a district level hospital or a primary health center, we don't have, equipment to deal with children. Simple thing, a mask, an oxygen mask appropriate for an infant. No, it's not available. Most of the primary health centers. So this is the time we need to prepare, you know, all our primary health centers, and we definitely don't have enough pediatricians. Okay, and the number is quite grim. How many doctors do we have? I don't know the exact numbers, but the number is quite grim as to how many children are handled by a single pediatrician. And if you go deeper in the rural areas, see, most specialists would like to practice in cities. We have a dearth of specialists in rural areas and remote regions, so that's why we need to be very careful.
So that also brings me to a point, right? We just saw that breastfeeding also causes is one of the measures of transmission. How do you think can that be done in the safest way possible?
Okay, so for example, we have a baby born to a mother who is COVID positive. CDC recommends isolate the child. Okay, but if the mother wants to feed the child, she need to wear the mask and she can feed the child. There is no risk of transmission from the mother to baby in the womb. Neither there's risk of transmitting virus through the breast milk.
But then we just saw that misc is something that happens because of if the child comes in contact with someone with COVID or around, right? So isn't that? How is that? This is slightly contradicting and slightly confusing.
No. So suppose as I told, I don't have exact numbers. How many thousand children out of which one gets a misc? Okay, it's a rare thing. One study was mentioning 1 in 25,000 to 1 in 30,000 may get misc. So the number is very, very, very small. Okay, so we don't have to worry so much about it. But having said that, when we have lot of kids getting affected, the number of misc also will rise, and that's why we
Okay,
need to be aware.
got it. That brings me to the next issue that you mentioned, right? The Kawasaki disease. What is different about that?
Okay. So if you look at Kawasaki disease and MISC and toxic shock syndrome also, there is a lot of overlap. Okay. And what is Kawasaki disease? Basically, it's an autoimmune disease wherein our own antibodies are fighting our organs. We would normally see it in some seasons wherein children suddenly develop these features. We don't know the actual cause, but what we think, it's usually triggered by a viral infection. But in this scenario, COVID is triggering a Kawasaki like illness. Okay, the features are overlapping, as I told you, and that's why we need to be careful.
We have a question here. What does an NICU mean?
NICU means neonatal ICU. So neonate is a child, as a baby who is less than 1 month.
And they also can get this entire virus in a
Yes,
way, right?
yes, they can also get, and they can also develop pneumonia.
So
Especially
you've
premature
been
babies. Preterm babies are babies who are born before 37 weeks of pregnancy. They are at a higher risk to develop COVID.
okay. And how do you think we prepare for it? Right? Do we have the medical staff? What will it take for us to prepare for this?
Okay. So if you look at the whole scenario, right now that we have time, we need to go in a stepwise approach. Okay. So we are dealing with one condition. So we don't have to provide big courses or big things. We need to deal with one disease. And if we can train people, okay, who are already involved in medical profession like doctors, nurses, healthcare workers who are at the remote level also. So from stage one would be to make them aware. okay, of what these things are. So what is severe COVID, how to identify it when they have COVID, and once they have COVID, they should also know that in the next few weeks, in several weeks, they may develop misc, and if it develops, how to identify it. So we need to create small videos or pamphlets how to identify these. And so every parent should know, if my kid develops these, I need to take attention, medical attention immediately. And once you identify, so for that, we need to really go hard in distributing information to the remotest part. And next step, once you identify, we need to have a proper referral system in place. Okay, if there's a kid in village suspected misc, where would this kid go? Does the primary health center have facilities to handle it? Okay, or the rural health center has it? Okay, do they have a ICU to manage such kids? Do they have medicines required to handle misc? Okay, and the key lies in handling them early. Identifying early is the key, because we have time to treat. The more you delay in identification, the prognosis becomes bad. So coming to training, suppose we have kids who are really sick, we missed out and they're sick, how to handle those kids at a rural level. So in a primary health center, so we need to train nurses and doctors in basic courses like BLS, basic life support. So how do I handle a very sick child? What do I need to do? So when you do these courses like basic life support and pediatric advanced life support, you get confidence, you get hands-on experience. How will I handle such a kid? Otherwise, believe me, I have seen my adult friends who say, when they see the kid, sorry, I can't handle this. This is too small for me. I'm scared. So even doctors who have medical knowledge, who are physicians, I have seen this inherent fear. Yes. Even me, when I started doing my residency, I was scared to hold the baby, small baby. Yeah, it's so too small. How do I handle? So it's not easy. So we need to prepare, and this preparation is very, very important. So as I mentioned, train key doctors and nurses in BLS and PALS courses. Okay, and every primary health center, we need to equip them with pediatric accessories like basic oxygen mask, an ambu bag, small IV lines, IV fluids. And then once we have all this, there's something called crash cart also. Crash cart contains all emergency medicines, okay, all emergency stuff required for pediatrics, children of different age groups. Okay, so this must be provided in all primary health centers. And as I mentioned, referral system should be in place. Okay, if I identify a child in a remote village, how do I go about it? Whom do I call? Whom do I refer to? Okay, and they should have a proper system in place. How will I transport such a kid? How much time will it take? So this homework need to be done, and if we do it, yes, we run a good chance of managing this third wave if it comes. And of
So,
course, as I mentioned, online training, expose people to what can COVID do to children. As I just mentioned about severe COVID and post COVID, you may develop misc or Kawasaki. Just make them aware. Have online webinars wherein MBBS students, just finished, fresh graduates of MBBS, can ask questions. Okay, they can be equipped. They can develop confidence. Oh, I know about COVID in children. Okay, physicians who deal with or other specialties. And of course, what medical supplies do we need? The primary basic things would be oxygen. Okay, should be supplied, should be available. And once you have misc, the main line of treatments are steroids and IV immunoglobulin. When it comes to IV immunoglobulin, this is a very expensive drug. Okay, and this has to be made in. This is not very easily available, freely available. And if we have a third wave, like we had the dearth of uh, the medicine amphotericin to treat black fungus, this could be a challenge.
So, doctor, I just have one. Like, we're coming to the end of the segment, but I just have one big question. Right? You mentioned there are levels that we could identify when it comes to navigating a kid, right, from one place to another, or just identifying if the level of care that a child needs. How can a parent identify it? Like, suppose I have a child, how do I identify if my child needs basic level of treatment or an ICU or whatsoever? And of course, because most of us come from privileged backgrounds, we will have access to that. If we are to make it available to rural India, what do you think will it take?
Yeah. So as I mentioned, when a child has COVID or COVID pneumonia, we need to identify the symptom which I mentioned in the video and this slide, where you have fast breathing or distress or grunting. These are alarming signs. Or cold hands and feet, persistent diarrhea and vomiting, drowsiness. These are alarming symptoms. You need to take immediate help. Okay. And once a child has COVID, they must always have in mind, yes, in the next 6 to 8 weeks, they must be careful if a child develops rash or swelling around the neck or a strawberry tongue. So this can happen only when we create awareness.
Yeah, got it. I think the few takeaways that I'm going to take is one, we need to create more awareness. Maybe keep doing these sessions, and the chat room is open for all with respect to if you have more questions, if you think there are some areas that we haven't covered and could be covered, or just some sessions that we could have with Dr. Natwar. I'm sure we can block some time on his calendar and get him on and ask him to share it with us. But if you are to summarize, right, Dr. Natwar, what do you think should we anticipate in the next third wave? Is my last parting question to you. How bad can it get?
So that's difficult to predict. But having said that, most important is please maintain precautions. Prevention is definitely better than handling a situation. So we are still not out of the woods, I would say. Okay. Corona is still lingering around. So please take all precautions. Don't think, yeah, we are done now. The worst is over. Numbers are coming down. No. We've already seen it in the first wave. We thought we are done with it. The second wave hit us very badly. Okay. And we can't afford to lose children. Believe me, I mean, I'm not trying to say all lives are equal, but when we lose a 80, 90-year-old gentleman who's lived all his life full, we lose them, we can still say, okay, he's lived his life. But when you lose a child, it's definitely not easy at all. Okay. So please, precautions are very important. Number two, I think soon we'll have vaccines for children too, like we have flu vaccines. So please be careful until we get vaccines approved for children. Yeah. Number three, if you get COVID, so just keep in mind these are the alarming symptoms. Okay. And once you get that, please get to a doctor as early as possible. That is from a parent's point of view. But from the government's perspective, they need to be prepared. They need to really, and this is a very good time to actually equip the healthcare system and improvise it. Yeah. To cater to pediatric care also. And I think, attention will go to children care now, because if you look at all those health centers where they lack facilities for children, they'll be equipped. So instead of starting to get oxygen from the world over when we already have a crisis, it's better to be prepared. That would be my
Thank you.
message.
Thank you so much, Doctor. Maybe, every time we say climate change is something that we will pass on, like we should fight climate change right now so that we pass on a better world to our future generations. Maybe in the short term, we can take precautions and pass on a better tomorrow to kids who are yet to come in this world and are out there and destined to come in the next few months. But
Yeah,
thank you
and
so much,
most
everyone.
important,
Sorry.
sorry, one more thing. Another important thing is children who are at high risk. The slide which I mentioned, where are children at high risk, they must take real extra precautions, because in those children, COVID can be more severe. So that is another important thing we need to keep in mind.
By high risk again, can you just
So
can you
children
just
who are immunocompromised, who had cancers, who are on immunosuppressants, children who have heart disease, existing heart diseases, children who have lung problems, children who have kidney failures, or children who have neurological problems, or obesity, uncontrolled type 1 diabetes, and premature babies, they need to be extra careful. Like we used to say, adults who are diabetic or hypertensive, heart disease, who are at high risk. Similarly, children who belong to this category are at higher risk. So they need to take extra precautions to avoid. And once
Doctor, there's
vaccinations are
another.
Mhm.
So most children these days are born with asthma, right? Like they have breathing issues and stuff like that, or even cold because of pollution and environment that we generally live in. Is that also an area that will fall under high risk?
Yeah. So actually, well-controlled asthma, if you take your medications regularly, if you're an asthmatic, okay, it doesn't increase your risk of severe COVID. No. But if your asthma is not controlled, you're not taking medications, yes, you're at a higher risk of getting severe COVID. But otherwise, there is no generalized increased risk or mortality as of now. We don't have complete data on it. But if you control your asthma well, yes. Those who have asthma intermittent once in a while, they don't have an extra higher risk with COVID.
I think that puts me to peace with all my cousins I know and who have the same issue. But I think this was really good and extremely insightful for all of us to prepare. And on behalf of the Crypto Relief team and the VHR project, really thank you for this and for your time. I'm sure if we have questions that come in and many more awareness sessions that we'll be doing in the future. But for now, thank you so much for setting the context for everyone.
Thank you for giving me the opportunity. Any questions? Or
So we'll be opening for questions. We have addressed most questions that came in. Uh,
Mhm.
Maybe if people have questions, we'll give it a minute, or I think we are good.
Okay, great. Okay. So I think there are no questions. Thank you so much.
Thank you so much, Doctor. See you soon.
Bye bye.